Is this working? Okay. YouTube. All right, we're going to play this. And I have no idea if this is working, but hey there. I am going to share my screen with you. And we are live on YouTube. This is Dr. Michele Arnold from wellwithdrmichele.com. And today I'm going to talk about the Acupuncturist Essential Gut Program, Conquering Inflammatory Bowel Disease. Dr. Michele Arnold from wellwithdrmichele.com. And today I'm going to talk about the acupuncturist. And this is me, Dr. Michele. Wellwithdrmichele.com is where I have my online courses and workshops. My local acupuncture practice is in Poway, California. And I made this program based on my book, Conquering Inflammatory Bowel Disease, an Acupuncturist Essential Gut Program. You will learn powerful ways to use essential oils and food therapy to heal Crohn's disease and ulcerative colitis. I have to give a disclaimer. Of course, these methods, products, and material, essential oils, have not been evaluated by the FDA. The products and methods are not intended to treat, diagnose, cure, or prevent illness or disease. It is not a substitute for medical advice. In other words, use your common sense, right? What you will learn today is that you can find food in your own pantry, in your own local grocery store, to help yourself feel better naturally without drugs or side effects. There are some awesome essential oil protocols and recipes that you can apply topically. I will tell you where and just give you a few easy ones. Essentially, we want to balance a disharmony, a pattern that is developed over time in your body using these natural methods without drugs or side effects that are easy to use and follow. A little bit about me. I'm Dr. Michele. I'm a doctor of acupuncture and herbal medicine. I've been in practice for over 20 years. I'm an author and holistic health educator. Why I developed this program? Well, I found as an acupuncturist that I could say an overwhelming majority of people that come to see me for arthritis, joint pain, back pain, you name it, do have digestive issues. And some people have a definite diagnosis and where their issues really do interfere with their life. And then there are people that just live with it. Maybe that's just more of some annoyance or feeling uncomfortable with some indigestion. So I, would see people with irritable bowel disease, inflammatory bowel disease, which is even more serious, GERD, reflux disease, bloating, gas, just feeling rather uncomfortable. And acupuncture was amazing. I mean, it really helps. And if I often even focus on that, a lot of the other complaints get better. And part of what I do is help people with their nutrition and food therapy and give them guidance in that respect. And when they follow my plan and what I had recommended, they would get better. And I decided to put this together because it's really important to just have a high quality of life, and it's important for your muscles and joints as well to be able to absorb the nutrition and food that you are eating and taking in. And also Chinese medicine is been around forever. It is not a fad. It's not going anywhere. It isn't new. There has been a lot of trial and error over a lot of people over a very long time, and it works. And there's a lot of confusion about how to eat healthy. So simplicity is always the best, and moderation. So how long should you expect to feel better once you incorporate new, healthier ways to eat? The results could take you up to 3 months, maybe more. I mean, it does depend on your overall health and your condition. But why? I mean, you really need to give your body 3 months to heal and not give up and not feel impatient. And that's because it takes that time to really totally cleanse your blood. And I explain that by just looking at your red blood cells. They have a lifespan of about 120 days. So that is the average time also that it takes tissue to regenerate. Now, different tissue in your body generally takes different time versus a nerve cell, a bone cell, stomach lining. So those are all really different. But if you just average it out, it's about 3-4 months. And also, that's about how long it takes a person to develop new, healthier habits, like a new regime, a new protocol, new diet, therapy, and exercise routine. And once start developing that, you're crowding out the bad habits. So, and it's best to develop a routine, like a morning routine and an evening routine, like waking up at the same time every day, going to bed at the same time every day, having your meals about the same time every day. Your body gets used to it. What should you expect? Well, we should expect to heal your gut lining, heal your ulcers, um, stop pain and cramping, stop diarrhea, increase your energy and strength, and just to get back to being you again, to feel better, to have a better outlook on life. I do have an online course where I take you through it as your coach, and it is at my website, wellwithdrmichele.com, Conquering Inflammatory Bowel Disease, because there we can be a community. I have video tutorials to go along with each step. But let's start here at patterns of disharmony as they're seen in acupuncture medicine. If we take you through the 5-element theory, we can see that everything is related. All of our organ systems are related and they affect each other. The fire element has to do with our heart and small intestine. The earth is our spleen, pancreas, and stomach. The metal is our lungs and large intestine. The water is the bladder and kidneys. And the wood is the liver and gallbladder. I'm going to talk about today a disharmony between the liver and the spleen. So that's the wood overacting on the earth here. And there are other patterns, and more specific to digestive problems, and that we can see constitutionally. The most common are, first, balanced, healthy spleen, pancreas energy, and that is what we all want to ascribe to. That's what we all want to. That's where we want to be at. That's where we want to maintain. And the next one we often see is an energy weakness, chi energy weakness. Then we have chi energy weakness with feeling cold, with cold patterns. We have damp heat in the intestines, chi and blood stasis, phlegm dampness. The liver and spleen disharmony with chi stagnation. That's what we're going to talk about today. Deficient yin fluids, a wind special constitution, and then we have acute attacks from the environment, pathogens, or eating bad food, or an accident or injury. So the liver and spleen disharmony with chi stagnation. This has to do with digestion and metabolism. We can see this pattern in gynecology and infertility as well. We can see it in breast health for women. We can see it in pain symptoms like fibromyalgia, for an example. Mental and emotional health like anxiety, depression, insomnia, and headaches and migraines. So that might explain if you have ever had acupuncture, and let's say you were seeing me for irritable bowel, and I do a set of acupuncture points, and then I give you a recommended diet, and I also give you an herbal formula, and a pretty common one is called Xiao Yao Wan. And then you refer a friend to me for anxiety, and then maybe you're having lunch or breakfast together, and you're talking about, hey, how did you like Dr. Michele? And oh, she gave me this herbal formula, Xiao Yao Wan, and here's a list of my recommended foods. And then she put a point here and a point here, and then you're thinking, well, that's weird. I'm seeing her for something different, but all of that sounds the same. Well, that's because you both probably had the same pattern of disharmony, the liver spleen disharmony. And that is why the when we address the constitution, the constitutional pattern disharmony, we can treat many different diseases or many different symptoms and complaints. And that is why acupuncture medicine is so holistic in that way. So somebody with different disease can have the same disharmony or the same disease, but you may have a different pattern as one of those patterns that I had mentioned earlier, like the yang weakness with cold. And I love this picture because when we talk about the spleen channel in Chinese medicine, it includes the pancreas. And it just think of it like saying for short. And this is a great image here. And it shows how everything is a system. So if we just look at and not look at the liver, but we look at the spleen and the pancreas and the intestine right here, this whole thing is really a system. And so when we are talking about the spleen, we are talking about the pancreas, not just its ability to make insulin, but also the digestive enzymes. And the spleen grows out of the end of the pancreas like a stalk here. And that's why, when you have a spleen, when your spleen is removed, for certain injuries or illness, you can the pancreas oftentimes will take over some of those functions of the spleen, and maybe part of it can even regenerate, like the liver, parts of the liver can regenerate. So it's really the spleen pancreas and the functions in Chinese medicine. When we look at it this way, then it makes sense that it is very, very similar to Western medicine, just that we look at it more as a system. And the small intestine right here. Um, so that is what is so awesome about this image. So, what constitutional signs and symptoms would you see maybe in yourself or in somebody that you know that might have a liver spleen disharmony? Well, responding poorly to stresses, stressful situation, everyday life, a person who is irritable pretty easily, impatient, moody. This person tends to have repressed emotions and feeling very frustrated, not letting it out, or angry. Anger is often the root. It is the root of depression. It is the root of frustration, repressed emotions. And some people are either yang, where they're violently angry, always just flying off the handle, and then the other person is deficient in their liver and holding it in and quiet, but they are angry. It's just inside and not getting it out. And this affects the spleen, and the spleen is the worry organ. It's the one responsible for that overthinking, always just thinking about the future, the past, impending doom, the what ifs, instead of being in the here and now and the present. And you see that worry, does affect your digestion, because that is what the spleen and pancreas and liver together all do, is help you metabolize and digest. And signs and symptoms that you would see, and we're talking about digestive signs and symptoms, and some other things as well. So feeling of tightness and discomfort in the upper ridge of your rib cage, or more even on the left or the right side of your rib cage, bloating in the stomach. The rib cage area just feels tight and uncomfortable, especially after eating. And these problems and complaints may come and go. They may vary in intensity, like go up and down, and in location. Like you might complain of tension here, and the next day it might be a little bit more right here. Maybe you have headaches, maybe you have joint pain. Things just kind of change. Everything gets worse with stress or emotional upset. Things are just irregular, like we were just explaining, up and down, different places. And we see that with irregular menstruation and irregular menstrual cycles in women. And that's liver qi stagnation, or the liver invading the spleen, when there is also digestive problems like diarrhea or constipation with the onset of the period. So in digestion, sometimes it can be pretty irritating or confusing when, let's say, if you have irritable bowel or constipation or diarrhea with inflammatory bowel disease, some foods one time will help, and then another time they won't seem to do anything, or another time it'll make it worse, or some foods that are supposed to help, won't. So that gets to be, pretty confusing and irritating. Like, let's say, peppermint. Peppermint is great for irritable bowel. It's great for constipation and moves the intestines, but stops that spasm. But if you have GERD or reflux, the peppermint can make that worse. And some people, maybe they'll say it helps, and some people it doesn't. We see this liver and spleen disharmony with irregular menstruation, women that have breast lumps and painful, bloated feeling, distended breasts during or before their period, and that they come and go. Infertility, infertility for both men or women. Women, menopausal symptoms, the irritability and the mental confusion, and the hot flashes when there's more heat signs. And men, I put men, but men and women can be, angry, and but just saying that with men we can see problems with the prostate. And so health problems generally maybe have no clinical findings. You've seen your doctor, they've run tests, and there's no pathology in the tissue. And that is pretty common with the irritable bowel, where it's more functional of the motility of the intestine, but not a pathology in the tissue like inflammatory bowel, where there are definite, there is destruction, there is disease, there is, ulcers, sort of like a canker sore, in your mouth. Digestive symptoms for the liver and spleen: frequent bowel movements. The stools can be kind of pellet shaped like a rabbit. There may be loose stools or diarrhea, or constipation, especially in the case of irritable bowel. And with irritable bowel, the diarrhea or loose stools can alternate. Can have a feeling of incomplete evacuation, like you're just not done. You went, or maybe you've gone several times, but you always have that feeling of having to go, and you feel like you always have stool in your intestine, it's ready. There may be nausea, belching, or acid reflux. What are the causes of this imbalance? Well, as I mentioned before, the liver stagnates from repressed emotions, like holding things in, not speaking your mind, feeling very irritable and impatient, shallow breathing, like not breathing from your lower abdomen. Your lower abdomen should be rising and falling like a balloon, filling with air, getting that nice deep breath, and bringing that diaphragm down, and that expands the rib cage. Well, when we aren't breathing correctly, we are using our upper neck and shoulders, accessory muscles. Everything gets really tight in our upper traps and neck, and we just get a lot of tension, and we're not getting that enough air, and we're also not squeezing out enough of the old air when we're breathing too shallow. Eating poor quality foods, polyunsaturated oils, those vegetable oils and corn oils that at one time we thought were good for us, but now we know that, hey, if it isn't natural, it isn't good for us. Eating too many fatty or greasy foods, fried foods, too many spicy foods, sugar, white sugar, refined sugar, white, flour products, alcohol, too much alcohol. See, everything is dose dependent in Chinese medicine, meaning that some of it can be good up until a point, and then it can go over that little bell curve and start to be detrimental. Like 1 to 2 glasses of wine can be healthy, as studies indicate. And then when you get to 3, 4, you starting now, it's starting to be unhealthy. And of course, that has to do with your, gender does play a role in that, and also your weight and size. Synthetic chemicals and drugs, and just think about what the liver does for you. It metabolizes everything, chemicals, breaks it down, and also your own hormones that you are making. So it's constantly working and cleaning your blood, and it can get backlogged when it just has too much junk to break down, and it gets congested. So if you are drinking too much alcohol and you're trying to lose weight, well, the liver has to detoxify that alcohol first before breaking down the fat. So you are not going to lose weight. You're not going to do a good job if you don't either cut out the alcohol or really bring that down if you are drinking too much. It just slows down the energy, chi energy movement. And when we say chi energy, we're really talking about function of your organs and your breathing. And with your breathing is energy because that is oxygen. And with correct digestion and metabolism, we are getting nutrients from our food and drink. So all of that makes chi in our body that every cell needs, right? Okay, so we know that chi is a real thing. It is also an idea, but it's just so much easier to say chi, isn't it? So develop habits to help. The first thing you can do for a congested liver is to eat less, like portion control. Maybe take a day or two to do a fast. It doesn't have to even be, much. It can just be, once a month you take a day or 2 days and do a juice cleanse, or just have, water and herbal tea for a day. Get plenty of exercise outdoors. Your body needs the sunshine. It needs to see the color green. Green is good for the liver. Yellow color, like from the sun, is great for the spleen. Take in that color green. And I mean, you can even think about green and you can look at green. Slow down your lifestyle. That is your own perception as well, how you think about things. Just try to be more patient and have more positive self talk. So that's where meditation comes in, to relaxing the mind, turning it off, and just focusing on your breathing is a great way to start meditating. Start developing new, healthier habits, new protocols, new daily regimes, and it's just a new, healthier way of being. Don't worry about like having to change something or to stop doing something, or you just have to crowd out the bad health habits and crowd out the bad thoughts, because you'll get used to it as you every time you start to think, oh, I'm too fat or I can't do that. Just stop and then say it the opposite way. I am healthy. I am strong. I love exercising. And then just your brain will start to believe it. So, food therapy that can help you for a spleen and liver disharmony. Bitter greens. Think. And these are just quick, short little lists. I can't give you everything here today on this short little webinar, but in my course and in my books, I do have larger lists. But bitter greens like alfalfa, collard greens, cabbage, kale, daikon radish. It's actually white, but it does have a bitter spiciness to it, and it is good for your liver. Bitter herbs like dandelion leaves, milk thistle seeds, and there's a Chinese herb, chai hu or blue purum. Culinary herbs to use in cooking: spearmint, peppermint, oregano, basil, chamomile, or just steep in hot water to make a tea for a few minutes. You can steep fresh oregano or fresh basil, and it's really quite good. Spices, use these spices in your cooking. Black pepper is warming and spicy. Ginger is sweet and spicy and warming. Cayenne, just a little bit, it's spicy. Garlic, leeks, onion, cinnamon, sweet and spicy and slightly warm. And cinnamon is good for your blood sugar levels and shoulder pain too. Grains and starchy vegetables. Yes, you need these. You do need starch. You do need starchy vegetables. And you will learn if you take my course why and why you need a combination of these starchy vegetables with the non starchy vegetables. Because if you have any of the aforementioned digestive disorders that I mentioned, you are not eating your foods, correctly, irritable bowel or inflammatory bowel, and these things can be your friend. So you will, and everybody's worried about, of course, fat and blood sugar, but eating them correctly, you will not have to worry about that. And I hate to say it, people that have gone completely starch free are not thin and are not, free of diabetes and or they end up with some other digestive problem or low energy. So it's just everything in moderation. It's just learning how to eat right. So these grains and starchy vegetables, basmati rice, quinoa, and mind you, quinoa is high in protein, so that can serve as your starchy grain, but it's really a seed. And then protein, wild rice, which is not rice. Everything's confusing, right? But wild rice, buckwheat, rye, corn, barley, and then all of these different things can be sprouted, and that is another healthier way to eat the grains. So some non-starchy veggies, mushrooms, I mean reishi mushrooms, shiitake mushrooms. They're so good for you. They help your cellular health, like just help your energy. Carrots. Carrots are great for your immune system, great for your eyes, great for your nervous system. And the beta carotene, they are good for your skin, good for your digestion. That's why they're here. Zucchini. And did you know that zucchini helps you absorb the pasta if you cook it with pasta, and keeps the blood sugar levels low? Just a little tip. Seaweeds, great, and you don't have to add salt, of course, if you're eating seaweeds. Olives and radishes and cilantro. These olives, radishes, and cilantro are great added to, on the top of a meal, on the top of a side salad, on the top of a soup, on the top of, a sandwich, or um, they, your liver likes these particular things, and it's just enough raw food, because most of your food should be cooked, most of it should be warm, but a little bit of raw is good, unless we were talking about a different pattern of disharmony. So most of us are eating as if we have a tremendous amount of heat, and are eating too many cold raw foods, and we're just injuring our digestive system. And that might be why you're here. That might be why you're listening to this, is that maybe you're eating too many cold raw foods and salads. Fruit. Citrus peel, the peels of the fruit. There are some dishes where you can stir fry the orange peels, and you can, you wouldn't eat them, you remove them, but they can be steeped in a tea. And there are some Chinese herbs, citrus peel, chen pea. Grapefruit, and remember, grapefruit can decrease your blood sugar levels very quickly. So if you are on an anti-diabetic medication, it's probably contraindicated, and you need to, watch out for that. But it always makes me wonder, like, why didn't you try eating a grapefruit, every day, um, naturally, before starting on the drugs? That's just me. Just, hey, if because once you're on medication, it's really hard, you know, um, unless you need to work with your doctor, and that, if you want to try to get off of them. Apples. Apples, great. The darker the red, the better. Okay, the skin. Avocado. A half an avocado a day is great for cholesterol. Your liver loves them. Legumes. Black beans, kidney beans. Yes, these lovely things will help your blood sugar at least by up to 40 to 50%. They can help you maintain your healthy blood sugar and cholesterol levels. We need to start eating these, and cooking them correctly makes a big difference on eating them without any problems of gas or bloating or pain. And if you're not used to eating them, you need to start slowly, because if you don't eat a food, your body can't digest it. You need to develop the digestive enzymes. You'll learn all about that in my courses. Nuts and seeds, olive oil, pumpkin seeds, walnuts, toasted sesame seeds, a sprinkle on top of again, soups, sandwiches. Use them in a smoothie, a green blender drink. Proteins like goat's milk is easier for humans to digest than cow's milk. And I believe it's just today, there's just too much in our cow's milk. It's processed, homogenized, pasteurized. But, what's the other alternative? You have, um, there's just a lot of theories out there about, whether or not raw milk is good for us. And it is easier for us to digest. But if you're afraid of bacteria, then you want to get the pasteurized milk. But goat's milk is easier for us. So goat's cheese, also eggs, fish, herring, fowl, meaning, chicken, turkey. Royal jelly is really a superfood, and it is a great one for women and infertility. It's high in protein. Quinoa, see, it's here again because it's high in protein. Rabbit. I don't know many people that eat rabbit these days. I mean, a lot of these things have just become outdated, or at least in our culture, that people aren't eating. Um, but there it is. Sweets, we want to eat these sparingly for this liver and spleen disharmony, but some of these I mentioned do have some health benefits. And when you eat them sparingly, I mean, you're not going to eat much of them a day, 1 to 2 teaspoons or 1 to 2 tablespoons, and that's all you need of them. And you are getting the natural enzymes and minerals that are naturally occurring in these sweets, and they can help sweeten some of your food or a blender drink like honey. So I buy my honey that is organic and unpasteurized. Licorice root, stevia, unrefined cane sugar, and it's actually kind of brown, and the little crystals are a little, thicker, like you can see it. It just and now when I see white refined sugar, I kind of feel grossed out by it, like, wow, I want to put that into my body. So the unrefined cane sugar, and it will say unrefined cane sugar um, on the package. Maple syrup, again, I buy unpasteurized, I mean organic maple syrup, molasses, and rice syrup. So it's just an idea here, a quick sample, like chicken stir fry with miso sauce, adding some white beans, cannellini beans or kidney beans, kale, carrots, and walnuts. And with your meal, you can sip on hot broth or a hot tea, or, also you could have a side salad with those sliced radishes and cilantro. After dinner, sipping on hot peppermint tea helps with digestion. Going for a walk after eating really helps get you moving and helps you digest instead of going and sitting down right away. Skip dessert if you are worried about your blood sugar or your weight. You don't have to have a dessert, but we do need all 5 flavors. We really do, or we start to feel, like we're missing something. We start to feel deprived, and we don't want to do that, because then you end up going overboard. So, you can enjoy warm apples with some cinnamon and nutmeg. Just one example. Here is a quick essential oil topical recipe that I like, that helps soothe the liver and boost the spleen. And putting this blend of oils on your upper shoulders, right here behind your neck, you can put it over your rib cage and the bottom of your feet. So these essential oils, you would dilute them with a carrier oil like a fractionated coconut oil. The fractionated part means it stays liquid. It doesn't get hard at room temperature. Or almond oil, or any other, carrier oil. You always want to dilute them. It does help your body absorb them, because they do help them from evaporating, because essential oils are aromatic, hence the term aromatherapy. The molecules do waft into the air, and after a while they dissipate. So you do want to dilute them. Here's one that I love, and I use this quite often in my acupuncture practice. Just take a few drops of peppermint, a few drops of marjoram, and a few drops of lavender. And I like it to be easy. Of course, you can pre-make this into a little bottle and then fill the rest up with the coconut oil. But you need the sterile bottle or a brand new bottle. You need to label it so you know what it is, because believe me, you will forget. And you should put what's in it. So I think that people get discouraged from using essential oils if you're not a DIYer. Some people love making all kinds of recipes and they'll go right to it. And then others love essential oils and want to use them, but they just, they don't have the time, or that's just not their thing. Well, just take them right out of the bottle, put the drops right in your hand, take your coconut oil, mix it up, and put it on. And that's it. Don't worry about it. That's what I like to do. So, food and essential oils, you can use, this therapy for many different digestive disorders, um, especially IBS and IBD. I mean, these are pretty common disorders. To stop the diarrhea, the pain, the cramping, bleeding can happen sometimes, and even mucus can be in the stools. Um, we want to heal the intestines and improve your energy levels, because sometimes people can be really debilitated from these digestive problems, and you may even have been hospitalized before, had surgery, and we want to avoid that, avoid it again, or avoid getting it to be to that level. So working at this level here for the pattern of spleen and um, liver, that is what we hope to do to avoid those severe problems. In my course, we go over 4 phases of healing for the inflammatory bowel disease with specific daily menus of healing foods. Like you really are going to be eating like one food, a rice congee, which is a healing food, with specific essential oil applications during different phases. So the severe phase is what I mentioned, you know, um, maybe having been hospitalized, or having to have IV fluids, maybe surgery, maybe you're recovering from surgery, or you're almost there. So it's going to be even more detailed than what I gave you today. The moderate, you're moving on to the next phase, mild phase. And I really, hope that we can move there as quick as possible, the mild phase. And then, of course, remission. And that is when you are back to health. And we want to maintain remission. So I teach you how to eat those fiber foods, insoluble versus soluble, and the right food combinations for healthy digestion and metabolism. So, what is your plan for health? You want to follow guidelines per your constitution to keep your symptoms from worsening, to help improve your symptoms, keep you in remission from the inflammatory bowel or inflammatory, you know, disease, irritable bowel, inflammatory bowel. Your overall health will improve, and other complaints as well, like joint pain or arthritis, your mood, your sleep, and just being able to eat and enjoy your meals without fear. I do have an ebook, Conquering Inflammatory Bowel Disease, an acupuncturist essential gut program to heal Crohn's disease and ulcerative colitis without drugs or side effects. You can find that on my website, wellwithdrmichele.com. Many of you have asked me for guidance where I will be your coach going through it. You can either buy the ebook and sign up for the course, do that together, or just get everything from the course, because there are video tutorials where I'm going to be going over each lesson. There's printable, PDFs, explanations. But with the course, of course, you can, contact me directly. You can ask questions and get answers. It keeps you engaged. It keeps you proactive. Be a part of a community. Calm the overwhelm by having a coach You can enroll at my site, wellwithdrmichele.com. You go to the course and click enroll. So please like this video, share this video, go to Well with Dr. Michele on Facebook, ask to join my private Facebook group. Share my website, because the more people that know about it, the more people we can help. Share the link to the ebook, should you go there, the Conquering Inflammatory Bowel Disease, the ebook, and share my course link. And I love you. Have a great day. Thank you so much for listening and taking the time. I'm Dr. Michele from wellwithdrmichele.com. And I love you. Have a great day. Thank you so much for listening and taking the time. I'm Dr. Michele from wellwithdrmichele.com. I would use the ebook and share my course link. And I love you. Have a great day. Thank you so much for listening and taking the time. I'm Dr. Michele from wellwithdrmichele.com.